Welcome to MedEvidence, where we help you navigate the truth behind medical research with unbiased, evidence-proven facts. Hosted by cardiologist and top medical researcher, Dr. Michael Koren.
Hello, and welcome back to another episode of the MedEvidence podcast. I'm your host, Dr. Erich Schramm, sitting in for Dr. Michael Koren today. I am a board-certified family physician and longtime clinical research investigator with more than 10 years' experience with the Encore Clinical Research Group. And I'm really excited to be talking to Dr. Jill Grimes today. For those who don't know Dr. Grimes, she is a board-certified family physician, so shout out to board-certified family physicians, of course. She specializes in teen, adolescent, and young adult health. And so she is also widely known as the TikTok college doc. So she's on multiple social media platforms. She goes on TV. She's an educator. And most importantly, for our purposes today, she is the author of the ultimate College Student Health Handbook. I'm holding the third edition in my hand right now, so I'm really eager and excited to dive into that discussion. So welcome to the MedEvidence podcast.
Thank you so much. I'm really excited to be here.
So, Jill, you've got such a fascinating background. Maybe you could tell us a little bit about where you grew up, what got you interested in doing medicine, and how you ended up pivoting into, adolescent and teen health. What did that look like for you?
So I grew up a lot of places. My father was a professor and as an administrator, and as he moved up the academic ladder, every couple of years we moved. So I was born in California, but lived a lot of different places. But I went to middle school and high school in San Antonio, Texas. And so that's how I ended up in Texas. And my dad, again, being a professor, I have a brother and sister. My sister is a doctor. My brother is an engineer, but also has an MBA and teaches. So we were all very much indoctrinated into the more education is better. And the doctor part of it is a funny story. Literally, when I was in fifth grade, I had all A's and a C in handwriting. True story. Teacher pulled me aside and she said, "That's okay, Jill, you can be a doctor." And my handwriting has not improved. This is actually a plus of electronic medical records. But
I was just going to say that. That's great.
And I was not the only doctor with bad handwriting. I am not. But the reality is that I had teachers and educators along the way who were constantly saying, be everything, do everything. And I loved science and I loved helping people and I loved animals. I thought about being a veterinarian briefly, but mainly I just was focused on being a doctor. And to me, family medicine will love this, but to me, being a doctor meant being a family physician. And sure enough, in medical school, I loved every single rotation except anesthesia, and my husband's an anesthesiologist. I have an issue about spit, but anyway, I really loved every rotation. And the cool thing about family medicine is we get to do a little bit of everything. And so I did private practice for 20 years. And during that time, I ended up doing some writing. And I'm a problem solver, or I want to be a problem solver at any rate. And so I saw a problem in my very wealthy, educated private practice community about lack of education about sexually transmittable infections. And that is not a cool or fun topic. But it was something that the education that I was doing in the exam room and that classrooms were doing with sex ed, clearly it wasn't hitting home. And that's because nobody thinks it's their group of people, right? We always think it's them over there. And so what started as a couple pamphlets for my office, which were stories, because stories are more powerful than statistics. My patients could tell me every story from Grey's Anatomy or ER. So I'm like, hey, let me try this method. But anyway, that ended up coming together and becoming a book. And that is how I started publicly speaking in general about health advocacy and teaching about how STDs are really passed around and how great, smart, beautiful, wonderful people catch them.
Wow. So I love that. So inherent in your of course, is curiosity, obviously, that drew you into family medicine, as most of us do, but also wanting to write and communicate, and that was that always natural for you, or was that something, a skill you really had to develop?
I would say it was rather natural to me. It's getting me to shut up that's the problem. So I I am the person who always spoke up when I saw that something I at least perceived to be an injustice. And sometimes I was right and sometimes I was wrong. But I was going to be, if I'm going to be wrong, I'm going to be all out there wrong. So the speaking up part wasn't hard. The awkward topic was hard, partly because I was a parent and I was a parent of two young girls. And it's a little awkward when your mom's on the radio talking about STDs. So there was some balance, there was some give and take there.
Well, but that's an important point, and by talking about it and being open and educational, right? Then you can help
Right.
to destigmatize a lot of that for patients. And so, in the
Yeah.
course of your the many years in your primary care practice, were you really focusing on doing adolescent and teen health and pediatrics, or were you kind of
Nope.
full service? Kids to the elderly, doing all kinds of all aspects of the practice.
I absolutely did all aspects of it and loved it and, started off wanting to still go in the ORs, but that ended up just not being practical with having your own private practice. And, the whole business part of medicine, not my favorite. Wasn't particularly good at it and didn't like it, but I definitely loved seeing all ages. And I had patients I did my residency in Austin and I stayed there for private practice. And so I had patients who I delivered their babies and then I delivered their babies in residency and early private practice. And so I had the full range and I loved all ages, but I have always had a special passion for teens and adolescents. And I think a lot of it was because, again, as being an outspoken person, sometimes I felt that adults were perhaps talking down to me or not appreciating the depth of the intensity of things that I felt. And so I've always tried not to do that. I really genuinely I think my special gift with patients is has always been that I can hear them. And even if I disagree with something or it wouldn't be a choice I would make, I'm not a finger pointer, because they point back at you, right? So
That does.
I I think that's how I especially connected with teens, and I love the potential that teens have. And then circling back to the STD thing, that when a young person who is just kinda getting started in the world and they're in high school or college and they're trying to figure out what they wanna do and what pathway and who they wanna do that with, and they end up with a sexually transmittable infection, they are often just destroyed, far more so than, medically, it might be something we can completely cure. It might be chlamydia. It's a
Hmm.
bacterial infection.
Hmm.
Boom, we're done. But they're not done. They are, oh my gosh, their image of themselves has completely changed. And so I am all about prevention. And that's always my push is let's get ahead of things. Let's educate so that young people can make different choices and informed choices because it's nobody's fault if they make a choice about a behavior or a medication or a drug if they literally have no idea of the negative potential side effects.
Well, I tell you, and I think credit to your book because you spend a great deal of time talking about prevention there, treatment, prevention, very holistic approach to all the different aspects and into what you're treating. I think, again, I love the family practice holistic element. I think as I read through the book, I'm like, well, this is great for college kids, but adults would get a whole lot out of this, right? Because it's a very holistic approach.
I've been asked to just change the cover and make it like,
Yeah,
adulting
your
101.
your daughter did a great job on the
Thank
on
you.
doing the illustrations for the cover. So it's a lot of talent there. So
She
that's
has a
terrific.
degree in animation,
Oh
so
wow.
the
Okay.
still pictures are very quick and easy for her, but that was such a surprise. I had when I submitted my book proposal and you of course include sample chapters. And I just included her illustrations because I've always had her illustrate for me when I give talks like at the AAFP or whatever. And it never crossed my mind that they would let her, or not let, would ask her to be the illustrator for the book. So that was a wonderful surprise.
Yeah, it's quite good. So that's
Thank
great.
you.
So you spent a number of years as doing student health at the University of Texas. Is that right?
Yes.
So you're an Aggie, but you were in the campus at University of Texas. How did that work out for you?
It was quite humorous, actually. And yes, this is an Aggie ring while I'm holding up my hand for the people who are watching. It's actually pretty hilarious that a good chunk of the doctors that work in the University of Texas Health Services are actually Aggies. So the truth is that, it's all just good fun. The students, love to razz me if they saw my Aggie ring, and I'd tease them right back because their Texas ring looks kind of like a copy of the Aggie ring. So now that I've just offended a huge group of people, but no, it was really great. And I do need to have a disclaimer that I am no longer currently working at the University of Texas, and love them, had a great experience there. Nothing I say, though, reflects them legally.
Okay, duly noted. So during this time, so obviously that's solidifying your experiences in student health, adolescent, teen health. And is that kind of solidifying your commitment to really putting that together into something more tangible? Is this kind of where the idea for the book's coming out at the same time? You said your daughters are heading off to college, but was this kind of a thought in the back of your mind at that time?
Actually, it was more than a thought. So when our girls were fairly young, their babysitter, who's our next door neighbor, who's about 8 years older than them, so 8 years before they graduated high school, she graduated high school. And their mom, who's a dear friend of mine, asked me if I would put together a first aid kit for Elise when she went off to college. So I did that. And I took it over, and I was so proud of this first aid kit. Had everything in it. And I'm real crafty. I was a Girl Scout leader, love to do all the artsy stuff. And my friend looked kind of disappointed as she opens it up, and she's like, well, Jill, this is great, but it doesn't have you in there. How is she going to know when to take Tylenol versus Advil? What cream to use? What does she do if she gets food poisoning? So she runs to her kitchen and she gets index cards out, and she starts rapid fire asking me questions, and I'm rapid fire answering. So the next kit that I made for the next babysitter that graduated, I had a little laminated booklet that I put together, which grew to be a 26-page laminated booklet. And by that point, I think our girls were in, like late middle school. And I was like, oh, I have way more I need to include. This needs to be a book. And I had already written a couple other books. So it's like, this is what I need to do. So the book came first. And then actually, when I was taking a leave of absence from my clinical practice to finish up a book, I had my own practice for about 10 years, and then I worked for another practice for about 10 years. And while I was out on leave, that practice was sold to the hospital, and I didn't want to go back into that different setting. And so I was kind of looking around, and I had always volunteered sometimes it was like one day a semester. It's not like it was a 10, but I had worked over at the University of Texas here and there for the whole 20 years, just really sporadically. And so I called them up, and they were, oh my gosh, yes, come over, join us. So it just worked out. The timing was perfect. And then it was so great for me as our girls did go off to college, that I was literally around kids their exact age, and, kids that needed mom hugs too. And, so it was really a win-win.
Wow. So terrific. So what does your practice look like now? Are you seeing patients, or what
So
keeps you
right
busy
now,
now?
I do not have time to see patients right now. Actually, I wear a lot of different hats. I'm a clinical instructor for UMass Medical School, but basically that's sort of grading papers and interacting that way. Obviously, that's not a huge commitment, but I do that. I work with Thread Health, which is a digital health for teens startup, and really focused on teen access to accurate, evidence-based, medical information. And so I'm creating content for them. And writing and speaking, and this has just sort of taken over my current practice.
Well, that's great. You multitasking, and it looks like you're doing great on every front for that. So congratulations.
Thank you.
So maybe we could talk a little bit more about the book that I'm holding up. So,
Sure.
So this is, so like you said, it's organized from head to toe. That's right. So,
yes.
And things that I thought were very impressive is the preface at the beginning and the introduction, which is, how to prepare your kids to interact with the health system, what to do, to walk into a doctor's office appointment. Maybe you could say just a little bit about that.
Yes, and I'll tell you that was one of the major additions, major things that we added to the newest edition. So I've been getting feedback, and that was a big thing if my kid doesn't know how to go to the doctor on their own. And so it starts off with something really simple. What is the first thing when you walk up to any healthcare, anything? So emergency room, urgent care, private practice, the first interaction you have is with the receptionist, and they're going to ask you for your health insurance card. So you need a picture of that on your phone, front and back. They actually need both sides. And as long as it's at least on your phone, you can email it to them standing right there, and you have it always. So that's just a really simple but really important thing, because when it's 3 a.m. and you're at an emergency room and you're puking your guts out or whatever the issue is, and you don't have your health insurance card with you, it understandably makes kids just kind of decompensate. They're holding it together until that point, and then they're like, I can't even get in.
There's not a lot of processing going on when that's happening. So that's right. So
exactly. So that's one. The second thing is that I think it's really important to teach our kids 2 things. And that is, number 1, lead with your most important concern. In an emergency room with a broken arm, it's obvious. In our family medicine practices, less so. If your real concern is that you're having terrible test anxiety, but you're too embarrassed to say that, so you got an appointment for stomach pain because it's giving you stomach pain that you have test anxiety, just jump right in there with what you're there for, because unfortunately, time slots are so limited. And then the next thing is, the biggest source of dissatisfaction with doctor-patient interactions is that the patient doesn't know what's next. So literally teach them, just remember those 2 words, what's next. So at the end, they get told, they get their prescription, they get a prescription for physical therapy, they get sent to the x-ray. They need to ask, what's next? If it's normal, what do we do next? If it's, if I don't get better from the antibiotic, what do we do next? When should I be getting better? How do I contact you? It's going to be usually through a patient portal nowadays, but you have to ask. So lead with the most important thing and ask what's next when you're done.
Right. And I'm hoping all the adults out there are taking heed and do exactly that at your next doctor's visit, because you'll be well prepared. And it's like you said, what's next? That's always the biggest question, and you want to make sure you're clear about that. So that's excellent. So can we dive into chapter 1? So chapter 1 is hangovers. And I was like, wow, that's really cool, because put it right up front, right out there. And I tell you, it's quite a really good chapter, because it talks about how to treat a hangover and how to prevent hangovers, and and it's a really holistic approach to that. But yeah, so and you make some recommendations about clear versus colored alcohols, and so how did you come about coming to all that, knowing all that and that determination?
Well, quite honestly, I wanted the title of the book that I submitted to the publisher was Hangovers to Hangnails. I wanted it just to say head to toe, boom. But publishers are smart about marketing, and the reality is that while many people might have typed in hangovers, probably they wouldn't have typed in hangnails, and it doesn't fully convey that this was a head-to-toe, guide. So hangovers was always at the forefront, partly because as our babysitters and their friends and our kids were in dance, so they always had friends 3 years older than them. I was giving these laminated booklets and first aid kits, which they all still have. It warms my heart. I get texts probably, I don't know, once every few weeks with one of these. I mean, I've given out many, many, many of these, and I'll get texts saying, "Dr. Jill, I just want you to know that I went through all my medicines were expired and I redid them and I re-upped it." Or they had a baby and they're like, "Oh, I've added new things for my baby,"
Wow,
which
that's great.
is kind of wild. But anyway, so there's always a lot of questions about hangovers and about specifically all the things surround so alcohol toxicity and hangovers, which are different animals. But when do you need to get help? What were the signs of that? I wanted to be sure to communicate that. Some of the mistakes we see of people that are hungover is, number one, they'll take their ADHD medication. Their heart is, they're hungover. They have been throwing up. They have a headache. They're dehydrated and their heart is racing. And they take their ADHD medicine, which I will admit may actually help with their hangover. Not recommended, 100% not recommended. But then they go into kind of panic attack because their heart rate that was already fast is going a whole bunch faster. And that is so I wanted to warn against that. I wanted to make sure if they're rehydrating as they should be, that they're ideally using an official oral rehydration solution like Pedialyte. And because that's going to be more effective than just water. And don't drink coffee. People try to wake up. It's the same thing with the ADHD medicine concept. I'm going to wake you up because you have this brain fog. No, the brain fog is from inflammation and anything that just is a stimulant's not going to fix that. So that was really important to address some of those things that they can do that are actually harmful. And by the way, pro tip, don't use a straw when you are rehydrating after vomiting if you're still nauseous for any reason, because it can actually you get more air into your stomach and that can actually make you more nauseous.
Wow. See, these are going to be great pointers. So I'm going to have all my kids and their friends all take a listen to this when this comes out. So,
Awesome.
but also too, in that I think you make mention that, sometimes sensitive topics there if patients have concerns like, well, gee, could you put yourself in a compromising position, and getting back to testing and talking about STDs, because people get blackout drunk, they may so that's vulnerable people, so you have to consider that too. So
Yes.
yeah, and it's cool.
And if we could talk about that for just a second, I want to emphasize because now blackout drunk is not just, so first of all, blackout is not passed out. So for the parents in the room, blackout means that you have a memory gap the next day, whereas passed out is unconscious, and that's super serious. And you need to call for help if someone is unconscious. They're unconscious if you cannot wake them up. But a blackout means that you have a memory gap, and there has been in the party culture, unfortunately emphasized in the party section of TikTok, which is why I'm there, by the way, is the party call a blackout or back out. If you don't get drunk enough that you forget part of the night, you have apparently not had a good time. And obviously not everybody is doing this. It is, less than a third of college students, but it's a significant number. And it's concerning because there is this misperception of if you can't remember, it doesn't matter. Family medicine, we can immediately think of a couple outcomes where it matters, right? Any kind of accident, whether it's just stepping off a curb and getting a concussion, or whether it is sexual assault, pregnancy, STDs, all of these things. So it does matter even if you don't remember. And these are the kind of things that I think it's really important to have real conversations with teens and young adults, because other people are not having those conversations. They're saying, don't drink, or you can't drink till you're 21. Well, that would be great. That would be ideal. I would have no problem if no one drank until they're 21. But that is not the reality of our culture in the United States today.
Right. And as a physician, you're always daily having to face with reality. So, and doing the right thing for your patients. So, yeah, that's a really good point to make. Another chapter that struck a chord with me was the chapter on anxiety, depression, and homesickness. And so, and again, you give some really good, some pointers there, and maybe you could elaborate on that a little bit.
Sure. Well, this time of year, the biggest thing is homesickness. We've got kids who just moved in or are about to move in, and we've got kids who maybe moved in early and went through the Greek system recruitment, used to be called Rush, and maybe they didn't get that sorority or fraternity that they really wanted. And these are tough ways to start the year. So the biggest thing about homesickness is looking forward rather than back. The more that you are looking on social media at your friends who are all at different schools and obviously posting their highlight reels, as are you, it just makes you feel more lonely and you're missing the past. The best thing you can do, I have this rule of three. Pick three organizations to join. And I'm talking join, not try out for, not audition for, just straight up join. And I encourage people to pick three completely different organizations. So maybe a service organization, maybe something just super fun. If you like intramural sports, something like that. Or if you love movies, joining a movie club. There's trust me, there's something for everything, but something service, something I'll say frivolous like foodie or movie or whatever, and something maybe in your major. And that way you'll meet three different groups of people. They all share one thing that you like, and you'll start being able to see who you really truly jive with, because at first there's all this pressure to be friends with your roommate or your suite mates, and that may be great, or you may, they may be somebody who sort of is a ship passing in the night. So you got to dive in.
And, I think another important point I recall reading is like, the kids that might want to come home on the weekends, and try to reconnect there, right?
Yeah. So honestly, I see this just as frequently, if not more frequently, from the parent perspective of if your kid goes to college within, say, an hour and a half radius, there is a big drive to, especially if it's the oldest, oh, come home for your sister's volleyball game. Come home for Sunday dinner. Oh, come home, I'll do your laundry for you. And none of it is, it's not trying to control them, but what's happening is they're being pulled backwards, and they are not having the sitting around in the laundry room where you meet some other random person who's also sitting around in the laundry room. That's when those friendships are formed. And I found, like, Austin, Texas, obviously you have the huge University of Texas right there, but some of the people who are the most homesick literally live in the same city. So it's not correlated with how far away you are. Sometimes I think the people who are far away, and both of our girls actually went over 1,000 miles away, different directions, but you're kind of forced to jump in and do things because it's not an option to go home. So I think sometimes that's helpful.
Wow. So I want to go back, and you would have been seeing patients during COVID. Do you recall that time frame and how COVID, how that affected those kids growing up and then going off to college, and did that contribute to some of the issues that kids are seeing now?
Well, I don't think there's any question that COVID disrupted all of our lives. And certainly there's a good argument that students in general, all ages, got disrupted the most. But it's very, I actually only saw students during the first year of COVID, really first 6 months or so of COVID. But the hard thing is that, each challenge is unique to each grade that they were in when they were completely on virtual school, right? And now we have a whole group of college students who were affected all to some degree or another during all of their high school. And I think we're seeing a lot more difficulty interacting with other people in person, seeing a reliance on virtual classes, and more colleges. It's quite a surprise to parents paying tuition that there are a lot of really outstanding schools who still have a lot of classes that are also offered online, or maybe only offered online. And it's a big transition to go from what they had as a COVID high school class online to now a class in university online. And I just I think it's really important for students to recognize that it is a different situation. They need to jump in. They need to be responsible for connecting with that professor. Again, my dad was a professor. When my brother and sister and I went to school, the rule in our household was, if you're in college, the first 2 weeks of every semester, you go around to office hours and you meet every one of your professors. It doesn't have to be a long conversation, but go to their office hours. So you're going when they expect students, and just introduce yourself and, use context clues. Look around the room. If they've got pictures of something that you like, maybe they're skiers, or I don't know, whatever they do, but comment on that and talk to them as a person. And it's going to just set you up for so much more success. And I think it's important to even do that with your virtual classes. And all the professors I know feel very strongly that the kids who do that are the ones that succeed the most.
Right. I always feel strongly that we're so much better in person, and hopefully
Yes.
one day we can do a podcast in person, and but yeah, and I'm glad to see it, with my kids, that they've really embraced doing a lot of that, showing up and being there and knowing their professors and their TAs, and so I totally agree with that. One other thing, so one thing that's really impressive about your book is it's evidence-based. So let's take, for instance, the chapter on sinus infections and runny nose and sore throat. So, and you, again, kind of reiterating the point, look, this really isn't the place for antibiotics. And, and you can, for all of your recommendations can go back, and you can go back and reference and say, look, this is really evidence-based practice. So it is that time of the year when everybody's catching the things that are going around. And so maybe just kind of reiterate a little bit about, an approach to when you get that cold, when you're getting that sinus infection, kind of the best approach for that.
Right. And it is, I want listeners to know that from the doctor standpoint, it is way easier to give an antibiotic unnecessarily than to have a 5-minute discussion about why you're not giving an antibiotic. So we're not doing that. And we don't make money from the sale of antibiotics. There's no conspiracy there, but trying to convince people that they don't need antibiotics for a viral, green snot does not equal antibiotics. That's the take home message. So what we want is for students to treat symptoms, and have a thermometer so that you can check your temperature. If you have 103.7 fever, we probably want to see you. If you've got 99 temp and a stuffy nose and sore throat, and you're functioning fine, probably that's a time for over-the-counter medicines. And obviously I can't give individual personalized medical advice, but by and large, most respiratory viruses and sinus infections are going to be viral, and we don't want you to come in at the first sniffle, but we also don't want you to wait until you're in crisis. And that's true whether it's a horrible, sinus pain, or whether you're in crisis from test anxiety or anything. We're there to help. And if you have questions, and particularly young college students, this is the first time they're managing these symptoms on their own. But that's why most places have 24-hour nurse hotlines, and you can call and you can get recommendations. And if you just keep in mind, if you take other medications, like if you're on prescription ADHD medications or antidepressants, anti-anxiety medications, some of those interact significantly with cough and cold medications. And so that there needs to be a discussion with a medical professional, including a pharmacist. If you're getting over-the-counter medicine, the pharmacists are well-versed in what is going to interact and what is not.
Right. And I think a great point about your book is making it clear, at what point you need to engage a doctor. It's one thing to nurse symptoms at home, but when in doubt, here's where you need to go and how to contact those resources. So that's very, very helpful. I'm also now looking towards the bonus section of the book called Do It Yourself First Aid Kit. And I'm like, holy cow, this is fantastic. You've got there's literally a checkbox. I love that first aid kit. So To that point, so the if you're at home with the sniffles, sore throat, or cough, or whether you've got a rash, or whether you've got whatever you have, upset stomach, diarrhea, dehydration. I mean, there's all kind of things here, and you really it's very clear, very concise. So again, us adults need to have something like this at home because again, these are going to be
Yes.
so helpful.
Right. And when you need it, you need it. When you're throwing up all night at 3 a.m., you don't want to have to make a run to the store to get an oral rehydration solution. So I keep those single serving powders in there. So you've always got it on hand. That's really important. And even if it's just that you need an ACE wrap, again, if you're hobbling around, be nice to have it at your fingertips. If your roommate's coughing all night and keeping you from sleeping, it's really nice to have some over-the-counter cough syrup if it's appropriate for them to take that. And also, I'm going to put in a plug for Narcan. This is something new that we've added to the first aid kit. Narcan, everyone knows about the fentanyl crisis, the opioid crisis in our country. And I think what a lot of parents miss is that they expect that these fentanyl overdoses are only going on in like party, raging partiers, right? And there are kids that will take all kinds of substances to party, but they know that they're taking a risk. And I certainly hope that they have Narcan on hand as well. Something that a lot of parents don't think about, however, is that kid who is so anxious that they can't sleep. They've got a chemistry test, Gen Chem test coming up, and they can't sleep. They've been studying for 3 nights, and their roommate says, "Oh my gosh, just take this Xanax, and so you can get a good night of sleep," right? Well, if that's a prescription Xanax that was prescribed for that roommate, 1, you still shouldn't be taking it, but 2, that might be safe. But if it's a Xanax that they got from somebody else because they were having trouble sleeping, now, if it's a street drug Xanax, there is a very strong chance that there's fentanyl in there. And that's why it's one pill can kill. It is college students, young adults who are looking for a simple fix to a problem. They think they're getting something that is not risky, and yet it can stop them from breathing. So Narcan is a spray that can reverse that. So I think that's an important thing to have.
Yeah, that's a great point. I mean, Narcan saves lives, and that's the reality we're living in right now with the opioid epidemic. So absolutely. I know we talked a bit about sexually transmitted disease, STDs, and I'm referring back now to look at chapter 45. Very well written, but maybe touch a little bit about how, because a lot of young people think, well, if I've got an STD, I'm going to have symptoms, right? Something's going to show up, and so I must be okay, right? Hey, I must be all right, right? I mean, what could possibly go wrong there?
Or I had symptoms. Oh, thank God, my symptoms went away. I had some burning there when I was peeing at first, but it's been 2 days and it hasn't happened anymore. So I must be fine. So yes, we have to get the message across that sexually transmittable infections are honestly most often silent, and yet they can do damage, particularly in young women. The biggies that we worry about missing are chlamydia and gonorrhea, and those can go on to create problems, scarring, chronic pelvic pain, and even infertility in women. They're easily treated. They're bacterial illnesses. Actually, gonorrhea, let me step back. It is a bacterial illness that is not easily treated because it's got so much antibiotic resistance.
Superbugs.
I shouldn't be laughing at
the superbug.
It's actually gotten a little scarier, but chlamydia is very easily treated, but we have to know it's there. So if you are sexually active, meaning that you are being sexually intimate with other people, then you need to be checked once a year at least.
Yeah. Do you think in terms of the treatment, and as far as a clinician, are you just going to, go ahead and just presumptively treat? Somebody comes in and says, I think I might have something. Are you going to just say, okay, well, look, we're going to presumptively treat you for gonorrhea and chlamydia, or are you going to wait for the test to come back?
It depends on the setting. Nowadays, in a college health setting, students are highly, highly motivated and likely to come back. So typically we would test first. There are certainly public health clinics where there may not be as consistent a follow-up where there is presumptive treating.
Yeah. And that makes sense. I mean, it's your patient population at the end of the day, and you know them and what's best for them. But you also make an important point about follow-up. So if you're going to get treated, go back and make sure you're clear. Is that right?
Absolutely. And the other thing is, I've always said that STDs travel in packs. People are always shocked, almost always, 98% of the time, pulling that number out of my head. But from my experience, the vast, vast majority of people are just shocked when they're diagnosed with a sexually transmittable infection. Like, how could this happen to me? How could that person have given that to me? But they're even more shocked when they have more than one STI. And see that all the time. A lot of times it's genital herpes and chlamydia, or, pick your match. But the reality is that they're all transmitted the same way. So of course we see a lot of them together, and gonorrhea and chlamydia have been together so much that a lot of times we empirically do treat for both when you're positive for one. So the major message I want to get across, though, is just get tested and understand that if we are offering testing for, say, HIV, so many times people say, oh, they're not that kind of person. Like, there is no that kind of person.
Exactly.
That's right. We are all that kind of person.
That's
right. These bugs don't care what you look like or how much money you have or where you live or any of that stuff. And yes, they are more prevalent in certain populations, but the reality is anyone can get any of them. And if you're positive for one, you should be checked for all of them.
That's right. And I think the advice you'd given there was don't ever hook up with an ex, right?
If there's don't do the ex.
Don't do the ex, right?
Every primary care physician. So then, we broke up, but then I ran into him or her at this bar, and we all know what's coming next.
And adults too. Let's be clear that it's not just college kids, but maybe adults should be heeding this advice. Yes. So
even more so if it's an ex-spouse, guaranteed you're going to get it from
exactly. Okay. So that's an important take-home message for everybody. So Jill, thank you so much. You've been very generous with your time. And like I said, the book is tremendous. I can't wait to spread the word, because I know this is going to really sink home for a lot of people. Any question that I should have asked that I didn't ask you, or a point that you'd like to make?
I just want to reiterate the biggest mistake that I see in young adults, and actually really everybody, is waiting until you're in crisis to seek help. And part of that's because of all the barriers we have with access to care. And I understand that. But whenever possible, don't go in at your, second flake of dandruff or your first sniffle, but also don't wait until you're so miserable that you cannot cope with it, because then it's even harder to get in, and we can intervene with things, especially with anxiety and depression. And, mental health is equal to everything else. It is a valid reason to see a doctor if you have insomnia. That is a valid reason.
And this ties into what you're doing through your in your virtual health project that you're doing, right? That's that yes. Kind of access. And there's confidentiality in that for those patients.
Oh, absolutely.
Because I think a lot of times, 100%. Kids are like, well, are my parents going to find out about this stuff? And, they're hesitant.
We should add one thing, since you said that, especially this time of year. College students are mostly still on their parents' insurance. And what they need to know is that while there is complete confidentiality between the doctor and the patient, there is something called an EOB. That's an explanation of benefits. And it's not going to say your diagnosis, but it will certainly say pregnancy test or chlamydia test. We can't change the names on those things. And so students need to understand that if their parents are paying the bills, their parents are going to get this explanation of benefits that does have names of tests on there that would strongly suggest with context clues what's going on. So I think it's really important to have open communication about that.
Can those patients go to, say, like a public health office, public health department, and avoid
if those patients pay cash, if they go to a public health office is if you're not, it's purely if you're using your parents' insurance. If you're using your own insurance, you will be the one getting it. If you're paying for the insurance, it's whoever's paying, the guarantor, who is going to get it. So the workaround is there are many free clinics, and there are many places you can pay cash, and almost all college campuses now have free STI testing in particular.
Yeah, that's a great point to make. So, well, great. Well, thank you so much. I hope we'll have a chance to talk again soon. Is there another book in the works?
There may be another edition in the works, but not right now. Honestly, I've got my plate full for the next year.
All right, that sounds good. All right, well, thank you so much, and you have a great rest of the day here, and we'll hopefully talk again soon.
All right, thanks so much for having me.
Sure. Bye-bye.
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.